Hello, this video is for a pilot program purpose, and I want to speak a little bit about clinical motivation for home care providers. I will not be covering the whole presentation, but I do want to give you the piece that is most important for this purpose. So, one of the things that we seek to accomplish with clinical motivation is to empower our aides so that they can not only be motivated, but that so that this reflects in their care. And in the clinical motivation sessions, we discuss the role and the purpose of the home health aide. No one wins with a preventable hospitalization. Knowing the difference between emergency visits and follow-ups, becoming a healthcare influencer, an advocate, a voice, having passion, compassion, and empathy. The difference between being a maid and a home health aide, the do's and don'ts, and setting the appropriate boundaries. The home health aide as a lifesaver, the importance of using the sixth sense, retention through relationship, doing unto others what you would like for others to do with you or with your family, asking the nurse, the power of the word of mouth, refer an aide and patient session, and the importance of reporting. As you see, I'm just going to be skipping a few slides because I just want to touch on the most important topics for this um, program that we will be using for our home health aides. So the role of the empowered HHA, and here we talk about the prevention of hospitalizations, preventing unnecessary emergency room visits, knowing your patient, knowing the difference between emergency room visits and regular MD follow-ups, and using your sixth sense. There is power when you build the right relationships with your patients. You can retain your patients when you build a relationship with your patient. You can also have an effect on the healthcare decisions that they make. And this is what we are creating, the culture that we're creating at Ultimate Care. We know your common questions and concerns, and we have a solution for each and one of those common concerns. I'm just going to discuss the first one. So when you go to the patient's home and there is no plan of care, through the MedFlit application, you're able to access the patient's plan of care. And not only that, you can send an email to hha@ultimatecareny.com, and we will send out a nurse to provide a new plan of care to your patient. We have the do's and don'ts for an aide, which we also provide a copy to you during your in-service when you or any time that you come into the office. The best way to communicate any situation, whether it's patient status, patient's condition, or any question, any problem, any concern that you have, is through the email hha@ultimatecareny.com. This way, you not only the person that you're writing the email to sees it, but everybody sees it, and we can all help resolve your concern. The reason for using MedFlit now is that you will not only be able to see your cases there, but you will also be able to do your in-services through the MedFlit app. So it's really important, not only for your in-services, but if you want to hop into the growth process that we are creating here at Ultimate Care, you must use the Ultimate Care email for HHAs, the specially designated email. You must use MedFlit for your in-services and to communicate with your coordinator. It's also a tool. And you must use HHA Exchange to view the patient's plan of care, to also clock in your duties, and so that we can provide the best care possible, and so that you get the adequate credit that you deserve for the work that you do. So again, our communication tools are the email, the MedFit app, HHA Exchange, and our mass texting. We have reporting parameters, which you can also find in the office, and you can also request via email. You must report falls, skin abnormalities, abuse. You must report any abnormal clinical changes that you see in your patient. And as you see, the email is included here on every single reporting situation. Again, you report signs and symptoms of infections, noncompliance, no food in the home, abnormal vital signs, according to agency parameters. And these are the agency parameters, whether it's temperature, pulse, respiration, blood pressure, pain, or sugar levels. You can look at the normal ranges in this column, in the second column, the abnormal ranges in the third column, and what to do depending on the level of abnormality that you see in your patient. And these are all reportable through the HHA at ultimatecareny.com email. Okay? A home health aide is not only an aid for the patient. She becomes a translator. She becomes a transportation coordinator when she assists the patient to coordinate transportation to medical appointments. She becomes a medical appointment manager, even assisting those patients that cannot assist themselves, that cannot hear or cannot speak to make their medical appointments. This home health aide becomes an investigator. So you are there not only to do and complete your task, but also to report anything that is abnormal, whether there's no food in the home, whether there are symptoms of abuse. You become an investigator, you become a listener, you're a voice, an advocate, an influencer, an entertainer, a lifesaver. Okay, you are the eyes and ears for the medical team and your family. What would you like to be for your patient? The ultimate care growth pathway. Our ultimate goal is for every HHA to be consciously invested in reducing hospitalizations and unnecessary emergency room visits while increasing medical compliance. What is our purpose? To motivate our aides to grow within the organization and bring more aides and patient referrals, to empower our aides, increasing commitment and loyalty, to decrease preventable admission through adequate HHA reporting, to inspire our aides to go above and beyond, expanding on the role with passionate and compassionate care. We would like to polish company culture among our paraprofessionals, fulfill and exceed DOH requirements for HHA continued education and in services to increase retention of aides and patients. So we have three levels. The first level in our HHA growth pathway is the first level one. And it begins with an aide who is a beginner, a new aide. She has installed both applications, Medflit and HHA Exchange, and she has minimal language proficiency. Her benefits are traditional compensation and free ESL and continued education. Level two is where everything begins to unfold. And this home health aide has provided 1,040 hours to the company. She understands the plan of care. She is proficient in her reading and writing. She uses Medflit to communicate. She is punctual, reliable, and she has a 5-star patient review. So we are grading our aides the same way that the managed long-term care programs are grading us as a licensed home care agency. In the second level, you have increased pay, transportation assistance, free trainings, 50% towards advanced HHA education, company recognition and appreciation certificate. On level three, we have an aide who has completed 2,080 hours for the company. She understands the language, has both apps. She's reliable because she gets on time to her cases. She completes her in-services 100% online through Medflit. She reports at least once a month through her designated email, HHA at Ultimate Care and Why. And in this level, she not only gets transportation assistance and an increase in salary, but she also gets a bonus for her excellent quality care, yearly bonus of $500. So you refer and you win. When you refer an HHA or a patient, you get paid at Ultimate Care. You get a referral bonus. So please email all of your patient and HHA referrals to hha@ultimatecareny.com. Subscribe to our YouTube channel. Just look for us as Ultimate Care. And you are able to subscribe. You should be subscribing. You should like our channel and also click on the bell so that you can be alerted upon any new videos that we upload into the YouTube channel. Social media, find us, like us on Facebook, follow us on Instagram, and write to us. Share what you are finding here at Ultimate Care. Again, I want to welcome you to Ultimate Care and to the HHA Ultimate Care Growth Pathway. This is Nairobi Herrera, Clinical Director of Educational and Professional Development. Thank you and have a great day.